Hi, I'm going to be giving you your instructions, and these are your post-op for your oral surgery procedures that you're going to be having today. The first thing I give you is a Ziploc bag to have in the car, just in case you were to have any type of accident on your way home. Sometimes you're a little nauseated. Hopefully you won't have to use it. Second is the gauze. This gauze is placed back where we take the teeth out, and we will show you how to pack this after you leave. You take these, you open it up, and you'll take one gauze, you'll do it in half, and in half again, so it's the size of a quarter, and you will place these back in the socket and then bite down with the teeth. And we will show you, like I say, because every case is different, we will show you how these are placed. We give you enough to have at home. Now here's the sheet that you'll be given, and this is the post-op instructions from the doctor. The most important thing is the cell phone number. This cell phone number on the bottom where I will be highlighting is a number to call directly to talk with the doctor. You do not have to call our number and go through the exchange. We want you to be able to go straight to the doctor and have any questions answered. The first thing you're going to do when you leave here, you have not been eating anything, so you're starving. So you're going to want to go get something nice and cool in your system. So there's different fast food restaurants around here. Something cool like a shake, a smoothie, yogurt, anything like that would be really good. We want to get something cold in your system, in your mouth, to help those blood clots get nice and hard. Get some food in your stomach before you go and start taking your pain medications. You're going to stop. I've called in 2 medications for you at your pharmacy, and you'll pick those up. When you get home, you're going to change your gauze, take your gauze out, drink a little bit more, and never ever drink through a straw. That's one thing I will highlight right here. Do not drink through a straw or eat crunchy foods for a week. And then you're going to take your pain medication, repack the sockets, and go to sleep. Now when you go to sleep, you can't curl up in a cute little ball and go to sleep. We want you to have your head elevated on at least 2 to 3 pillows. So when you leave here, you're going to have a little bit of bleeding. That's why we're giving you the gauze. And you can change that gauze every 30 minutes depending. Now we have a lot of saliva in our mouth. So sometimes you might think you're bleeding a lot and it's really blood-tainted saliva. So the best way to judge that is by opening up your mouth and taking the gauze out and looking back in at the socket and see if it's really bleeding or if it's oozing. Change that for the first 6 hours, about every 30 minutes as needed. And then we also want you to put ice. 30 minutes on, 30 minutes off, 30 minutes on, 30 minutes off for the first 6 hours too, and this will really help with the swelling. Those 2 things are on the first part here that I highlighted for you. Any sutures that doctor puts in will eventually resorb by itself. If you feel back there with your tongue, you can feel it. Don't be worried about that. These sutures will dissolve on their own. And it just depends on your own anatomy how long that will take, 1 to 2 weeks. The swelling will reach its maximum in 3 days. So do the ice, like we said. You can also chew and suck on ice chips. That's really good to keep cold in your mouth. And then keep your head elevated for the first 48 hours. If you take the pain medication and it makes you nauseated, you can sip on some Coca-Cola, some tea, or ginger ale every 15 minutes. But if it's too strong, you can always use over-the-counter ibuprofen 400 milligrams, and it's right here how to take that every 4 to 6 hours. Your diet today is going to be total soft foods. You're going to be having ice cream, puddings, applesauce, soup, jello, anything like that, so you can take your medications. Tomorrow you can start on your soft foods and increase, but don't drink through a straw and no crunchy food for 1 week. And the reason being is because when you get those little crunchy chips and they get back in the surgical site, you'll start picking at them and you'll disturb the blood clot that's back there, and you don't want to do that. That blood clot is your best friend for right now. Okay, so over here, you're not going to drive or consume alcohol while you're on any of these narcotics that we're giving you, and you need to avoid any heavy lifting or strenuous activity for 1 week. So you get out of mowing the lawn and taking the trash out for 5 days. If you need any excuses for PE, gym, or any of your sports, let us know and we can give you a written excuse for your school or your activities. Now, you cannot start brushing your teeth until 24 hours after this procedure. And when you do, we only want you brushing the fronts and stay away from the surgical site. Your breath is going to really not smell well. It's going to stink. So you're going to want to gargle and brush, and we don't want you to. Just brush the fronts for the first 48 hours. Tomorrow, you can start on warm salt water rinses, 8 ounces of water, a teaspoon of salt, and you're not to gargle with that. You're to just put it in, swish it around, and gently spit it out. We don't want a lot of pressure in your mouth. We want those blood clots to stay nice and firm where they are. We don't want to disrupt them. You might be going back to work or to school, and so I know your breath is going to be offensive. So you can get the little Listerine strips and just put them on your tongue. But don't worry about this. If your breath stinks, that means the blood clot's there, and that's just what we want. Just be careful when you start brushing your teeth again to stay away from that surgical site for the first couple of weeks. Other issues that could happen, you might experience some numbness, or you might not be able to open your jaw all the way. That is completely temporary, and just give it some time, a few weeks, and that will go away. Don't be concerned about this. This is the big one. This is the dry socket, and this is what I'm talking about. That's when a blood clot dissolves prematurely from the tooth socket. This won't happen right away. This will be 2 or 3 days down the line. And you might wake up in the middle of the night and say, wow, that hurts again up here. Don't be alarmed. That just means that blood clot was disturbed. And you just take your gauze again, get it wet, fold it up nice and tight, take one of your pain medications or your ibuprofen and put this back over the socket, because what it is there's air going straight on the bone, and that's what's causing you pain. Call our office, call this phone number again. We'll either get you in, we'll decide if we need to get you in for repacking, or just if this will take care of it just temporary till that subsides. If you stay away from the straw, you will hopefully 99% not get a dry socket. You might have a slight elevation in temperature, and that is why we're giving you the antibiotic. Again, it's only for 5 days, and please finish that medication. Down the line, some patients feel a little sliver or something coming up out of the site. That's just a little bone sliver. It's just like a little sliver coming out of your skin. And don't be alarmed and don't be worried. It works itself out by itself. The hole back there where we've taken the tooth out will gradually fill back in, and nothing you can be concerned about if you can stick your tongue down into it. That's completely normal. Again, the phone number here is to call. We appreciate you trusting Abari Orthodontics and Oral Surgery. And if you have any questions and have missed any part of this, you can go on our website, www.abariorthodontics.com, go in the oral surgery part, and there will be a YouTube video of this, and you can redo and learn anything that you've missed. Thank you so much.